Today I'm going to be presenting my PowerPoint on esophageal cancer. Esophageal cancer is a cancer of the esophagus that starts when the cell lining of the esophagus begins to grow out of control, causing the patient to have very hard time swallowing food or liquid. The leading causes of esophageal cancer are alcohol consumption and tobacco use, as well as gastroesophageal reflux disease. And this disease is when the strong acid in the stomach escapes from the stomach, flowing up into the lower half of the esophagus. And it's important to note the esophagus has is made up of several layers. The epithelium is the first lining of the esophagus and is made up of flat, thin cells called squamous cells. The lamina propria is right under the epithelium, and it's a thin layer of connective tissue. And the muscularis mucosa is under the lamina propria, which is also made up of tissue, and it's a very thin layer. The role of the esophagus is to connect the throat to the stomach, and there's a ring of muscle called the esophageal sphincter. And as you consume food or liquid, this muscle relaxes, causing the esophagus to open and close. And food and liquid then travel down the tube where it reaches another layer of muscle called the lower esophageal sphincter. And this ring of muscle, it relaxes, causing the food to enter the stomach. Patterns of esophageal cancer. So from looking from left to right, left is what a normal esophagus looks like. In the middle is an early stage of esophageal cancer, normally around like stage 2. And stage 4, you can see how the tumors begin to grow. There's a lot of black tar-like substance. This is stage 4 esophageal cancer. The genetics of esophageal cancer affects less than 1.1% of men and women. And the cause of this cancer is unknown, but more and more research is being done to figure out a cure for the disease, as well as try to prevent it. When it comes to family and genetics, several gene mutations like tylosis, Bloom syndrome, and Fanconi anemia can be passed down through families causing esophageal cancer. The risk of obtaining esophageal cancer is very rare in patients younger than 55 years of age, and men are more likely to be diagnosed with esophageal cancer than women. Progression of esophageal cancer. So, from looking from left to right, there's a healthy esophagus, and then, like I said before, gastroesophageal reflux disease. When the stomach, its acid goes up in the esophagus, these are what causes the tumors. As you can see in the middle, Barrett's esophagus is when the acid from the stomach creates like little tears in these thin layers, and then it causes tumors to grow in the esophagus as you can see on the right. Symptoms of esophageal cancer: difficulty swallowing is the biggest sign of esophageal cancer because the tumor grows in your esophagus and it's hard to swallow. Painful swallowing, pain, pressure, burning in the throat or chest, unintended weight loss, vomiting, regurgitation of food from the esophagus, persistent hiccuping, and chronic cough. Diagnosis of esophageal cancer. Doctors may use imaging like X-rays, magnetic fields, sound waves, or radioactive substances to create pictures of the inside of your body. And as the doctors conduct X-rays, you may need to do a barium swallow test. And this test is done by swallowing a thick, chalky liquid called barium. Barium coats the walls of the esophagus, making X-rays more inclined to pick out abnormal areas in the inner lining of the esophagus, like tumors. CT scans, MRI scans, PET scans, upper endosectomies are all ways doctors can diagnose esophageal cancer in any stage within the body. The effect of esophageal cancer on the exercise response. When diagnosed with esophageal cancer, there comes a factor of sarcopenia or decreased in muscle strength. This leads to a decrease in exercise capacity as well as physical fatigue. And as you can see to the left, there was there was a study done with 155 participants where exercise was measured using a cardiopulmonary exercise test as well as a muscle strength test. And the cardio included a 6-minute walk test, a shuttle walk test, and a street ramp test, while the muscle strength included chair stand test, muscle strength test using a hand grip ergometer, and maximal inspiratory and expiratory pressure. And while looking at the chart, the first example, there's a significant decline in the cardiopulmonary sector workload VO2 during the 6-minute walk test, as well as there's a decline in respiratory strength, as well as muscular strength with hand grip strength and quadricep strength also declined. And the second one uh, reduces. This one is a significant decrease um, in exercise capacity post surgery when it comes to the cardiopulmonary sector. The third, really no significant change. The fourth, there's a drop in hand grip strength and other physical activity metrics. Didn't show any significant differences between groups. And the fourth, it showed a significant decrease in all aspects, cardiopulmonary and muscular strength. Why exercise helps esophageal cancer? Number one, it improves treatment tolerance, reduces fatigue, and improves recovery. Uh, Number two, boost immune function, supports immune system against tumor cells, reduces inflammation, lowers inflammation linked to cancer progression. Mental health, exercise reduces anxiety, depression, and improves quality of life. And finally, enhances overall survival rates. Exercise in general limits or it's linked with better survival and function outcomes, even with cancer. Medication effect on esophageal cancer. Chemotherapy is a big one, and it weakens the muscles, reduces strength, and causes fatigue, limiting like the exercise tolerance. It also increases nerve balance affecting coordination, as well as psychological effects like depression and anxiety. Trastuzumab, it's also used. It's used for upper body esophageal cancers, and it can cause left ventricular dysfunction as well as reducing cardiac output and exercise capacity. It may also lead to fatigue, shortness of breath, decreased VO2. Ramucirumab is used in esophageal cancer treatment and can cause hypertension, blood clots, and slow muscle recovery, limiting high intensity or high impact exercises. So the case study that I came up with, my patient's age 65. She's a female diagnosed with stage 4 esophageal cancer. Has been a smoker since she was a very young age. Her diet consists of a large amount of carbs. She has been experienced signs of acid reflux for a couple months now. Did not really think anything of it. Comes from a family full of smokers. No past family history regarding cancer. Her number one goal is to be there for her grandchildren and her husband. Her second goal is to travel to the beach with her family, enjoy the remaining time she has. And her third and most important goal is to continue to make dinner for her husband every day. So my first exercise test, just before I make a program, I would put her through an aerobic test, and it would be a 6-minute walk test. I chose this test because of the low intensity exercise, and suitable for patients with low energy levels due to her chemo and other medications. And this test reflects just daily living activities, and it monitors heart rate as well as capillary oxygen saturation. For strength, I would put her through a hand grip ergometer test. And grip strength is a validator of overall muscle strength, nutritional status, and survival in cancer patients. And the hand grip is very portable and can be done anywhere. For flexibility, I would choose a chair sit and reach test. I would choose this test because it minimizes the risk of falling, avoids pressure on the thoracic and abdominal region, which is crucial for someone with esophageal cancer, and it assesses lower body flexibility. For balance, I would put her through a 4-stage balance test. I chose this test because it is quick to administer and does not exhaust the patients. And patients with esophageal cancer may have a balance deficiency due to the treatment, and no equipment is needed for this test. And one additional test, I would do the timed get up and go test. I chose this test as an extra test to give because it evaluates mobility, balance, walking ability, and or fall risk. So for aerobic testing, I would do 3 to 5 days per week. Start with three and progress as needed. Intensity, I would use the RPE scale 1 to 10. At the beginning of this exercise prescription, I would put her through RPE should be around 2 to 4. Keep capillary oxygen saturation above 90. I would start with 10 to 20 minutes per session, however, progress to 30 minutes while she's exercising more with me. I would, for aerobic, I would have her walk outdoors or on a treadmill, use a stationary bike, seated aerobic exercises, marching in place if very fatigued. For strength testing, 2 to 3 days, non-consecutive days per week. So maybe like every other day, maybe every other 2 days. Intensity, I would use an RPE scale again. Start with low resistance, 1 to 2 sets, 8 to 12 reps. Like I said, aim between 2 to 4 while she first starts out and progresses needed. Would use body weight, resistance bands, and light weights. Time 20 to 30 minutes per session, 6 to 8 reps targeting each muscle group. 30 to 60-second rest in between sets. Type, I would have her do bicep curls, wall push-ups, seated knee extensions, and the sit to stand test that I was talking about earlier. For flexibility, I would have her do flexibility every day. Have her stretch to the point of mild tension where there's no pain. Hold for 15 to 20 seconds. Repeat 2 to 4 times per muscle group. For the type of flexibility exercise, seated hamstring test, neck side stretch, seated calf stretch, upper back stretch, standing chest opener stretch, like a doorway stretch. For balance, 2 to 3 days per week. I'll start with easy, stable positions. RPE 1 to 10 again, based on off an RPE scale. Aim for 2 to 4. Use support as always, like a chair or wall. And I would have her challenging herself without causing like a fear of falling or instability. 10 to 15 minutes per session. Hold each balance for 10 to 30 seconds. And hold each balance exercise for 10 to 30 seconds. Repeat 2 to 3 times. For type, 4 stage balance test, sit to stand, um, seated balance, lifting like 1 foot in the air, and heel to toe walking. Precautions and modifications for exercise prescriptions. Precautions, I would monitor fatigue, because cancer fatigue is very high in cancer patients. Adjust intensity and duration. Always make sure she eats before and after while maintaining proper hydration. Avoid high intensity workouts, no heavy lifting. Monitor for wound healing post surgery. For skin irritation, avoid friction of clothing and equipment. So I wouldn't have the equipment rub against her clothing for skin irritation. For immunity, infection control in gym settings. I wouldn't really like put her in a gym because it's a very public setting. Respiratory issues, I'd monitor oxygen saturation and breathing, especially if lungs were affected by the treatment. And neuropathy, caution with balance. I would always make sure that I'm monitoring her balance because she might have nerve damage through chemo and radiation. Modifications, aerobic training 3 to 5 days per week. Resistance training 2 to 3 days a week. Flexibility training, gentle stretching to support mobility and posture. Um, Big thing for modifying, I would always start slow. And like I said prior, for my whole exercise program, I would always start a patient with 1 to 3, always have a patient go 1 to 3 RPE out of 10 in the beginning of exercising with me. Immunization, I would avoid public gyms and make sure my patients exercise in a clean, private environment. And feeding tubes, the last thing, I would always check for a feeding tube in patients with esophageal cancer. And I would avoid an exercise that puts any pressure on that site if the patient has a feeding tube. And these are all the sites that I got my work from. Thank you for listening to my presentation. I really hope you enjoyed it.